Okay, so today I'm going to be assessing the nervous system. So to begin, I'm going to start by asking my patient some orientation questions. So can you give me your name and your date of birth?
Nicholas Newton, 7195.
Okay, and what is the date today?
October 1st, 2017.
Okay, and who is the president?
Donald Trump.
Okay, where are we?
We're in Lawrenceburg, Kentucky.
Okay, and how are you feeling today?
A little bit dizzy.
Dizzy. Okay, so I'm going to go ahead and proceed and follow up with that dizziness. So I'm going to ask you a few questions about the dizziness. We're going to determine if it's vertigo, presyncopal lightheadedness, or disequilibrium. Of course, I'm not a doctor, I can't diagnose that, but we can make a pretty good guess as to what it is based on some of the symptoms that accompany each one. So, have you been feeling nauseated recently?
Yes.
Yes? Okay. And does it feel like you're on an amusement ride?
Absolutely.
Yeah, okay. So, those are classic symptoms of vertigo. So, my guess is that he probably has vertigo, but we could also assess for the other things. You've been passing out?
Yes.
You've been passing out? Okay. Do you black out when you stand up?
No.
No. Okay. And then, have you been unsteady when walking?
A little bit.
A little bit? Okay. Could you do me a favor? Could you stand up and balance on one foot for me? On each foot. Okay, so you're going to stand on one foot. Okay, and the other? Okay. So the patient has pretty good balance, so I don't think it's a disequilibrium thing, which would be if he was unsteady when walking, which, I mean, he's dizzy, he's going to be unsteady. But he was able to balance pretty well, so disequilibrium is probably not likely. Presyncopal lightheadedness, he does pass out, he says, but he doesn't black out standing up. Most of his symptoms fit with vertigo. So from there, I can just go ahead and look at the patient's face, look at the symmetry of the face, make sure it's even on both sides, make sure that I don't see his eyes crossing one way or the other, make sure that there's no issues with the face at all. And I don't see any. So that being said, we can go ahead and talk about the central nervous system versus the peripheral nervous system. So the central nervous system is made up of the brain, the spinal cord, and the brainstem. So we can go over the parts of the brain. And so right here would be your frontal lobe, this would be your parietal lobe, and back here would be your occipital lobe. On each side of the head would be your temporal lobes. So those are the four lobes of the brain. And then with the brainstem, there are three parts to that: the medulla oblongata, the pons, and the midbrain. Of course, we can't see that, but they're back here respectively where the brainstem would be. The central nervous system is responsive for the respirations, how much somebody can swallow, the pulse, the heart rate. So I can go ahead and check the pulse, make sure that the pulse is even on both sides, and it is. I can have him take. Obviously he's breathing. Obviously he's conscious. So his body temperature, he's warm, So and he's with us. So his central nervous system is functioning pretty well right now. And then we can go over the peripheral nervous system, which consists of the 12 pairs of cranial nerves and the spinal nerves. And so if we want to go ahead and assess those cranial nerves, so we can assess each one of those. So I'm going to have the patient to assess his olfactory nerve, which is the first cranial nerve. I'm going to have him smell something and see if he can smell it. Tell me what that smells like. Medicine. Okay, so he can smell, obviously, which is great. And then the optic nerve, I can assess his vision. So how many fingers am I holding up? How many? How many? 5. Okay. So then I can also assess his oculomotor movement. So I can have him follow my finger with his eyes. And he's able to do that. So his oculomotor, or third cranial nerve, is intact. I can also assess his pupils with the oculomotor. So I will take my flashlight. Sorry, I'm not prepared more. So I can assess his pupil reflex. Look straight ahead at me. Pupil does constrict with each check of the pupil. His pupils do constrict, so his oculomotor cranial nerve is intact. The trochlear, or the fourth cranial nerve, again, with the eye movement, we can have him follow my eyes. Don't move your head, just your eyes.
So,
Great. Okay, then he has good trochlear. He has a good trochlear cranial nerve. Cranial nerve number 5 is a trigeminal nerve. And this is the ability, it'll give you the ability to move your mandible. Also the ability to move your eyelids. So we can see that he can blink. Those eyelids are working. He can also, can you open and close your jaw? And can you clench your teeth? So yes, he can do all those things. So his trigeminal nerve is intact. The abducens is the cranial nerve number 6. And it also has to do with muscle movement of the eye, which we've tested multiple times, and he's very good at that, so it's intact. Facial nerve is responsible for taste and smiling, the opening and closing of the eyes, frowning, tears, and saliva production. So if he'll open his mouth, I can see that he has saliva clearly. I can also have him taste something for me. So he's going to taste one of these lovely nuts and tell me he can taste it. What's that taste like? Salty or sweet? A little bit of both. Okay. So, he can taste. Let's see if he can smile. And can he frown? Okay. So, all of those are intact. Cranial nerve number 8 is the vestibulocochlear. And he can hear me right now because he's following my command, so that is intact. Number 9 is the glossopharyngeal, which has to do with gag and swallowing. I just watched him swallow, so he's capable of that. And I'm not going to test his gag reflex, but if he's swallowing good, not having any problems with that, gag reflex is probably intact. 10 is the vagus nerve, and that's also responsible for swallowing. So if you can raise your neck, I'm going to just swallow one more time for me. Okay, so I saw all his throat muscles move just then. So the vagus nerve is intact. Cranial nerve number 11 is the accessory. And again, that's movement of the larynx, pharynx, and soft palate, which are all happening because he's able to swallow and eat and breathe and all that fun stuff. And then cranial nerve number 12 is the hypoglossal, and so he swallows well. It's responsible for that. And also tongue movement. So if I can have him stick his tongue out and move it around. Okay, great. He has movement of the tongue, so that is intact as well. So, from there, the next part of the assessment is we're going to look at bulk. So in looking at the patient, he has good even muscle distribution in the face, also, you know, in the neck, that sort of thing, on both sides of the body. Strength, so I can have the patient, whenever you're going to push your arms up against me as I push down against you, okay? So push up against me, and I'm going to push down. Okay, so he has good even strength in both arms. You can do that on the legs too, and just assess strength. So I can have the patient sit on the edge of the couch for me, and then I'm just going to have you hang your arms off the side of the couch like this, and then shrug your shoulders up from me and kind of roll them. Okay, and see how his arms dangle freely. They don't stiffen up really tight. They're able to move freely, so he has good tone. If I was looking for any abnormal movements, I'd be looking for tremors. I'd be looking for fasciculation, which are twitches of the muscles that are abnormal, and I don't see that in either side with this patient. And then I'm looking also at his station, which is his ability to maintain an erect posture, which he is doing right now. He's able to sit straight up, maintain his posture, he doesn't just fall back. So that's good. That's a normal finding. And then I can also have him walk for me, just back and forth really fast. And here I'm assessing his gait. And if he had abnormal, okay, so his gait is good. I was just checking for any imbalances in the cerebral or cerebellar function. If he had abnormalities there, then he would not be able to maintain that good gait, good straight, even gait.